Hi, this is Stacey Abbott with Corner House Realty. Welcome to another episode of Betcha Didn't Know. Today I am with Dr. Jason Shoe, the owner and orthodontist here at Shoe Orthodontics, and he's going to take us in and show us around the office.
All right, welcome. Come on in, everyone. We'll take you on a little tour. One of the things that we really value is making our atmosphere feel more like a home than a traditional medical or dental facility. So when you first come in, you'll often smell fresh baked cookies.
That's nice.
Every morning, one of our team members is making fresh cookies, and it's one of the things we've become known for.
Nice.
We also do a lot is putting effort into focus on kids as well.
Okay.
One of the biggest misnomers in orthodontics that it's also only kids that we treat.
Right.
And we'll talk a little bit later about some of the adults that we treat as well. And that's actually the fastest growing segment of our patient population.
Yeah. Sounds like a plan.
So one of the important things for us when you come in to see us is that you have individualized attention, individualized care, and our team prides ourselves on how they take care of one another. One of the things that we really try to do well is take care of our team, because our philosophy is if we take care of our team, they're going to do a better job of taking care of our patients in our community. And so one of the first steps when you come in as a new patient is to meet with myself and one of our treatment coordinators. And our treatment coordinator is essentially your quarterback for care. And so their job is to help figure out what it is that's bothering you and help figure out the best solutions for you and walk you through that entire process. And so things that you could expect, Stacey, when you come in for the first time, besides meeting with us and a conversation about what is concerning you the most, is kind of a deep analysis of things that may be affecting your bite, your teeth, your overall health, jaw position. We even talk about things like sleep apnea in children, because our big thing is to help folks realize the connection between what we do and other areas of health that you may not even have on your radar. Consultation, what to expect would be the meet and greet, where we're helping you figure out what it is that's bothering you most. You'll have photos taken of your teeth. We'll do a good exam, a dental exam of your teeth. We'll also take a 3D x-ray so we can see exactly what's going on as far as your teeth and your bite. And that's stuff that we can also provide to your dentist as well, so you don't have to get duplicate things done. And we do it free of charge. So the cost is completely free.
Oh, that's amazing. Very cool.
So this is what we would call our records room. And what you'll see in the room here are a couple of things that are super helpful for us from a diagnostic standpoint, but also from a patient comfort standpoint. So off in the corner is our x-ray machine that we can use to get a 3D version of anyone's teeth and jaws, which really helps us from a planning standpoint. The cool thing is you literally just have to stand there, play some really nice music, and takes about 20 seconds to get the image. So there's nothing you have to bite on. There's nothing in your mouth. So it's super comfortable. You're literally just standing there. The second thing is, as much as folks used to love those good old goopy impressions and those trays of things that we would stick in your mouth to get a mold.
Yes.
Yeah, remember those?
Yeah.
We don't do that anymore.
Great.
And so the way that we get those same records, and actually a better version of them, is using one of these machines. And we have several different versions of them, but they're called scanners. And basically, this wand off to the side has a fancy camera on the end of it that we pass over your teeth. It takes a three-dimensional picture and reconstructs it into a model of your teeth that we then have saved on the computer.
Amazing.
And whenever we need anything made that's custom, we can 3D print that model and then use that as a basis to fabricate something custom for someone.
Technology. So this is a really cool room. What is this room about here?
So this is our treatment room. So when folks are actively in treatment with their braces or their aligners, their Invisalign, this is where they would be seen. Kind of one of the cool things here is we've kept the original fireplace from the house. So in the wintertime, you often see the fire roaring.
Very
really
nice.
Gives a neat vibe to the area. Between that, we have a little separate section over here for that was meant more for adults if they wanted to be off to the side, or there's also a private room behind that door. But the big thing is we've found that most folks who are in treatment want to be kind of in the mix, so to speak. So kids, adults all tend to want to be in the same space.
Very cool. So you've mentioned treatment. So what do you offer here at Shoe?
So our biggest offerings kind of come in two big categories. One would be various forms of braces, which are things that stay on your teeth and help straighten them. And then clear aligners like Invisalign, which are removable trays. So our focus, and most folks think of orthodontics as straightening teeth, which is true. But we also really focus on jaw growth and development. So our big thing is if we can see kids when they're younger, there are potentially things that we can change as far as growth that help them develop in ways that may mean the difference between keeping all their teeth versus removing teeth.
Interesting.
Or changes to the bite that wouldn't otherwise be able to be done if we see them in the late teenage years. So from our standpoint, the most ideal time to see someone is around the age 7.
7. I was going to ask you, what is your youngest patient? About 7 years old is the good good
7
time to
years is a
start?
good age. We do have patients younger than that.
Okay.
And a lot of those patients will either come in for an initial check, and if they're not ready, we'll continue them on a path where they're just being seen for free of charge every 6 months to a year until they're either determined that they need
Right.
treatment or they
Okay.
don't. So we do complimentary follow-ups like that.
Wow.
And then the other big thing is, on the flip side, is we have so many adults coming in.
Right.
Our oldest adult that's come to see us over the summer was 89 years old.
That's amazing.
And so we have folks of all ages. We have plenty of adults who come in and say, you know what, I've taken care of my kids, I've taken care of my
Yes.
grandkids, and now it's my time.
Right. Everyone wants straight teeth.
Yeah.
I
And
mean,
so it's,
no matter.
as long as the teeth are healthy, we
Right.
can straighten them. Yeah.
That is really, really cool. So you have a kids program here at Shoe Orthodontics.
We do. Yeah. And there are a couple of aspects to that. So when kiddos come in for their first visit, again, it's about comfort. It's about making
Right.
them feel at ease. One of the nice things about orthodontics is there's rarely something that we have to rush into without significant repercussions. So that means if someone's not fully comfortable to
Right.
get started when they come in, we do things to ease them into it. And for
Okay.
kids, if they're not ready for treatment, one of the things we do is put them in our kids club, which is a
Okay.
complimentary program where they get one of these handy dandy hygiene kits that includes toothbrushes, timers, a nice little lanyard type deal with our
Cute.
mascot on it. And then also, I should say the lanyard is actually this part that's got a built-in thermometer on one side that just tracks how far along in progress they
Okay.
are during tooth development or growth of their jaws. And on the flip side, there's actually a chart where we can mark off which teeth they've lost, so they can keep track of which individual
So
teeth
do they come in
lost.
here with their lanyards on?
They
when
come in with their lanyards so that we can check them.
That's great.
And so that's one of the aspects of it. And then also we have a special connection with the tooth fairy. And so
Very important.
what you can do is scan this QR code here when you lose your first tooth,
Okay.
and you'll get a special message coming to you,
Aw,
just to you from the tooth
that's amazing. So you have a relationship with the tooth fairy. You know that.
fairy. We do.
That's
Yeah, we do.
amazing. I love that.
And that's all part of our kids program.
That's great. So why did you choose Reisterstown to run
So
your practice?
good question, Stacey. So it kind of comes back to my schooling. So
Okay.
I grew up in the Pittsburgh area, which I hope folks don't hold against
Okay.
me too
All
much.
right.
But so I grew up in the Pittsburgh area, went to Penn State for undergrad,
Okay.
Harvard for dental school,
Nice.
and then University of Maryland for orthodontic training. Actually, two of my instructors were Dr. Pick and Dr. Siegel,
Oh yeah,
who had the practice when I was first coming out of school.
I remember.
So I worked here as an associate from 2008 through 2015.
Very cool.
And left on good terms with Dr. Siegel, kept in touch over the years, and his current associate at the time was not interested in purchasing the office. And so I had kept in touch with him, purchased the office from Dr. Siegel in June of 2021.
Wow.
And so this is kind of my second go around here in Reisterstown.
That is.
And
I
so it's
love
been
that
great.
story. I love that story. Now, so as you know, at the end of every Betcha Didn't Know episode, we ask you a Bet You Didn't Know. Take it away.
All right. So I bet you didn't know. I often get asked, like, why am I an orthodontist? How did I get into this?
Right.
And I would say there are two different answers to that, or two different things that played into it. One is I grew up in a small town farming community, learned a lot of hands-on stuff from my father, very big into tinkering with cars.
Okay.
Actually in the process of trying to get a pilot's license right now as
Oh,
well. 'Cause
wow.
I just like anything with wheels and
In your
motors.
spare time.
In my spare time. So hands-on tinkering stuff really plays in well to the mechanical aspects
Okay.
of orthodontics. But the big thing is, on a personal level, is as a teenager, I had orthodontic treatment for a prolonged period of time, which culminated in 2 weeks after high school graduation with jaw surgery to change
Really?
the positions of my jaws
Huh.
because I couldn't chew food well based on the way I grew. And
Wow.
so it was such an impactful thing for me from a functional standpoint, but also from a facial appearance standpoint,
Yeah.
that I wanted that kind of opportunity to provide similar things for others. And so that's what really got me into this.
That's amazing. You guys, I'm telling you, if you haven't been here to see Dr. Shoe at Shoe Orthodontics, I think you're going to really like it here. It's very homey. It's very cozy. And please stop in and say hi. I guarantee you won't be disappointed.
Come in and say hi, even if it's for the cookies.
Yeah, for the cookies or maybe some tooth fairy gifts. Have a great day.
Thank you, Stacey.
You're welcome. Bye.